The University of Texas system offers the UT Select Medical Plan to eligible employees, retirees, and their families. It's administered by Blue Cross Blue Shield of Texas, with pharmacy benefits provided by Express Scripts. In this video, the Office of Employee Benefits will tell you all about UT Select. We'll discuss eligibility, premiums, plan design and benefits, the UT Living Well program, and resources. Throughout this video, we will refer to specific pages in the UT Select Health Benefits Guide where you can access more information. The guide is available at utbenefits.link/UT-Select-Plan-Guide. Plan eligibility. Medical coverage is included in the basic coverage package for all benefits-eligible employees and retirees. Eligible dependents may also enroll in coverage. On January 1st, 2023, most Medicare-eligible retired employees and their Medicare-eligible dependents move from the UT Select plan to the UT Care Medicare PPO plan. Active employees and their dependents, plus non-Medicare retirees and dependents of retirees, remain in UT Select. For more details, please visit utbenefits.link/UTCare. Employees and non-Medicare retirees residing in the Dallas-Fort Worth area may choose to elect the UT Connect ACO medical plan instead of UT Select. Information is available at bcbstx.com/UTConnect. Contact your HR or benefits office if you have questions about eligibility. Premiums. The state of Texas and your institution contribute premium sharing funds that go towards your basic coverage package and any dependent medical coverage. Employees can find their monthly premiums chart at utbenefits.link/EMP premium sharing. For retirees, visit utbenefits.link/RET premium sharing. Plan design. UT Select is a self-funded PPO plan. We partner with Blue Cross Blue Shield of Texas and Express Scripts to help manage the plan. However, as a self-funded plan, every dollar spent to pay for medical and prescription claims is funded by members, UT institutions, and the state of Texas. Two ways you can help moderate costs for yourself and all plan members are by using in-network providers and working with a Blue Cross Blue Shield health advocate. Your health advocate can connect you with plan resources and help you find high-quality, cost-effective medical services. UT Select is also a Preferred Provider Organization plan, or PPO. That means the plan contracts with medical providers and facilities to create a service network. With a PPO plan, you can receive care from any licensed doctor you choose, with no referral required. Network tiers. Each time you or one of your covered dependents need healthcare services, you can visit an in-network or out-of-network provider. You pay less and receive higher levels of benefits if you use doctors, hospitals, and other providers that belong to the plan's large network. In-network providers and facilities cannot charge you more than the Blue Cross Blue Shield of Texas allowable amount for covered services. Some out-of-network providers can charge more than the allowable amount. This can result in balance billing and a significant out-of-pocket cost to you. A special tier of healthcare services are included within our network. The UT Health Network is a collaboration between several UT institutions and the UT Select plan to allow our members even more benefits. It offers lower copays and coinsurance when you receive services from certain UT providers and at certain UT facilities. Find UT Health Network locations and details on page 10 of the UT Select Guide. In-network and out-of-network benefits charts are on pages 7 through 12. In-area and out-of-area coverage. Benefits are based on the subscriber's residence on record with their HR or benefits office. In-area coverage applies to members who reside in Texas, New Mexico, or Washington, D.C. Medical costs may differ for out-of-area members. See details on pages 11 through 12 of the UT Select Guide. Plan and member costs. All plan costs discussed below are based on the plan year. Your deductible and maximums reset once the plan year ends. The 2022-23 plan year runs from September 1st, 2022 through August 31st, 2023. The annual deductible is the amount of out-of-pocket expenses you must pay for covered services before UT Select pays benefits. Copays and prescriptions do not count towards your annual deductible. For in-network services, the annual deductible is $600 per individual and $1,800 for a family. Some services, like in-network and area office visits, are not subject to the deductible. With these services, you pay only a copay, regardless of whether you've met your deductible. A copay is the set amount you pay for certain medical services and prescription drugs at the time of service. We'll talk about specific copays in the following section. Coinsurance refers to the medical expenses you and the plan share after you meet the deductible. The in-network, in-area coinsurance is 80-20. That means the plan pays 80% of the allowable amount for covered services, and you pay 20%. For the UT Health Network, coinsurance is 90-10, so you will pay 10% of the allowable amount after meeting the deductible. The maximum you'll pay towards coinsurance is $3,500 per individual and $10,500 for a family. Copays are not included in the coinsurance maximum. The annual out-of-pocket maximum is the most you will have to pay for all eligible in-network expenses incurred during a given plan year. It includes copays and covered prescription drugs. For in-network services, individuals have an $8,700 annual out-of-pocket maximum, and families have a $17,400 maximum. UT Select pays 100% of the allowable amount for covered charges beyond the out-of-pocket maximum. Benefits. Let's discuss a few features of the UT Select plan. The plan offers $30 primary care visits and $50 specialist visits for in-network, in-area services. With UT Health Network providers, visits are $10 at employee clinics, $20 for primary care services, and $40 for specialist visits. UT Select participants have no copay for preventive care with in-network providers. Examples of preventive care are routine annual physicals, cancer screening mammograms, prostate cancer screenings, and well child care. You also have no out-of-pocket costs for lab and x-ray services associated with in-network, in-area office visits. Spotlight on telemedicine. Your medical providers may offer telehealth services by phone or video. You'll pay the same amount as in-person visits with the convenience of meeting from home. You can also access no-cost virtual visits through MD Live. You can receive medical care when and where you need it, 24 hours a day, for many non-emergency medical conditions. Additionally, MD Live offers virtual behavioral health appointments with licensed therapists and psychiatrists. Register for MD Live today so you're ready when you need care. Visit mdlive.com/bcbstx and click Activate Now to start your registration. Spotlight on behavioral health. UT Select includes several behavioral health resources, including some offered at no cost. Learn more from our behavioral health video available at utbenefits.link/bhresources. Spotlight on Progeny. The newest enhancement to UT Select is Progeny's fertility and family building benefit. It's designed to support all paths to parenthood. It removes barriers to care so you and your doctor can create the customized treatment plan that is right for you. Progeny is available to employees and their covered spouses on UT Select once they've been continuously enrolled in a UT System employer medical plan for at least 12 months immediately prior to accessing this benefit. Please refer to the benefit charts on pages 7 through 10 of the UT Select Guide for additional details about your benefits, or contact a health advocate with questions. Another document you may find useful is the Summary of Benefits and Coverages available at utbenefits.link/SBC. It includes a glossary link and examples of how the plan would cover various medical needs. Value-added services. Your medical plan includes several value-added services with no out-of-pocket costs. Blue Cross Blue Shield Health Advocates offer personalized, concierge-level customer support when you need help. Hinge Health helps members conquer chronic pain without surgery or drugs. Omada aids participants in reducing risk factors for heart disease and type 2 diabetes. Livongo is a simplified digital approach to diabetes and hypertension management. The Seasons of Life program helps you find claims resolution assistance after the passing of a loved one. Ovia offers support during fertility, pregnancy, and parenting journeys. Learn to Live offers self-paced online behavioral health courses. They can help you learn to understand and overcome challenging thoughts and feelings. Details about these services are on pages 36 through 37 of the UT Select Guide. Prescriptions. Your UT Select plan includes prescription drug coverage administered by Express Scripts. The annual deductible for prescriptions is $200 per member. This is separate from your medical plan deductible. You can obtain your prescriptions via a retail network pharmacy. For members with maintenance medications, save time and money with the Smart 90 program. Receive up to a 90-day prescription at a time for many maintenance medications through Walgreens, UT Pharmacies, and Express Scripts home delivery. Another way to save on your prescriptions is by asking your provider whether the generic version of a medication is right for you. Visit pages 58 through 63 of the UT Select Guide to find additional prescription plan features. Living Well. The UT System Living Well program supports employees, retirees, and their families in leading happier and healthier lives. You can take advantage of several Living Well options throughout the year, like seasonal wellness challenges, tobacco cessation resources, weight management programs, and discounted fitness programs. You also have access to the Employee Assistance Program, or EAP for short. It's a confidential service available through your institution at no cost to you. They can help you manage personal and professional challenges through short-term counseling, consultations, and referrals. Register for the new UT Living Well platform powered by Limeade. It helps you stay up to date with Living Well offerings, connect with colleagues, and find personalized activities to meet your wellness goals. Sign up for the Living Well platform at ut.limeade.com and download the mobile app once you're registered on the website. Learn more about Living Well programs at utbenefits.link/livingwell. Resources. To access your medical coverage information online, go to bcbstx.com/UT. Visit bcbstx.com/mobile for links to download the mobile app. Contact your health advocate at 866-882-2034. The Blue Cross Blue Shield Nurse Line is available 24 hours a day at 888-315-9473. Find your prescription information online at express-scripts.com/UT. To speak with Express Scripts, call 800-818-0155. The Office of Employee Benefits website is utsystem.edu/benefits. Follow us on Facebook or Twitter. On both, we are UT Benefits. Thank you for taking the time to learn about your UT Select medical plan.